We'll begin this hour with the first U.S. case of the Zika virus infection transmitted through sex. The case has been reported in Dallas, Texas. Local health officials there believe the virus was transmitted through sexual intercourse and not a mosquito bite. This comes just 1 week after the Center for Disease Control and Prevention insisted there was insufficient evidence to warrant a public warning about Zika transmission through sex. Meanwhile, Florida Governor Rick Snyder has declared a health emergency in 4 of the state's counties, as at least 9 cases have been recorded in the state. Well, for more, we cross live now to Marina Portnaya, who's in Miami. Marina, what's the latest in your state, Florida?
Well, Anya, this news is just coming out, so we're learning bits and pieces. What we know is that Florida's governor declared the health emergency, as you mentioned, in 4 counties where presumably the 9 recent cases of Zika were detected. According to reports, health officials believe none of the infections occurred in the state and that all the people who contracted the disease were traveling to the affected countries with Zika outbreaks. That's according to reports. Now, this emergency order allows Florida's agricultural department to use mosquito spray more in the areas that are under health emergency. It also directs the Florida Department of Health to make its own decisions about what's needed from the state and the Centers for Disease Control and Prevention. Now, this is particularly concerning for Florida because, according to reports, more than 5 million international visitors reportedly came to Central Florida in 2014. Officials say nearly 2 million of them traveled from South America, primarily Brazil, where the Zika virus outbreak began. Additionally, these mosquitoes, the Aedes mosquitoes that are the ones capable of transmitting the virus, those mosquitoes are in many parts throughout Florida. They survive and they live in tropical climates. They are found all throughout Miami. That is why it's particularly concerning for a state like Florida and other states along the south that have the species of mosquito that can bite someone and then transmit that infection to someone.
Well, speaking of states along the south, what about this case in Dallas now? Because for many, that sounds very frightening. Americans have been told for weeks that Zika is a mosquito-borne virus, yet this first local infection was transmitted in a completely different way. What do we know about that?
That's right. Well, according to the Dallas County Department of Health, the U.S. patient who locally contracted Zika had sex with someone who had recently returned from Venezuela infected with the virus. Officials say the locally infected patient did not recently travel to a country in South America. According to Dallas authorities, there's been no reports of the virus being transmitted by mosquitoes in the county where the infection occurred. Now, as we first reported last week, the World Health Organization has confirmed 1 sexual transmission case of Zika. Additionally, a Colorado professor claims he infected his wife with Zika upon returning from Senegal in 2008. Now, the CDC said 2 instances of Zika transmission through sex only suggests a theoretical risk. However, the Health and Human Services Dallas physician RT spoke with sounded quite conclusive when he described the first U.S. case of Zika transmission.
Days after the cold symptoms, and the sperm was tested positive for a Zika virus test. Well, now we know that also can be transmitted by sexual intercourse. Will that affect the baby? It's too soon to know because right now we know only that the semen was tested positive for the test. We don't know if the semen will affect the woman, and if the woman gets pregnant, it will affect the baby.
CDC Director Tom Frieden says the Zika virus is in the blood for about a week. How long it would remain in semen is unknown and something that the Federal Health Agency is currently studying, Anya.
Marina, though, when it comes to traveling and the mosquito issue, it seems a little bit easier for organizations like the CDC to manage. They issued a travel alert in response to the Zika outbreak exploding in Latin America and the Caribbean. What we're hearing out of Dallas now sounds a little bit trickier to manage. So is the agency planning to provide any instructions to Americans on how to deal with this potentially new method of infection?
Well, the CDC so far has advised men to consider using condoms after traveling to areas with the Zika virus. Pregnant women, the agency says, should avoid contact with direct exposure from men who have been exposed to the virus. In other words, use protection. That's what the CDC is saying. And the agency also says it will soon provide more guidance on sexual transmission with a focus on the male sexual partners of women who are planning to get pregnant or are currently pregnant. But despite this new evidence, mounting evidence that bodily fluids may also transmit Zika, many scientists and public health authorities insist that control measures need to focus on the major source of Zika, which experts say is still overwhelmingly the Aedes mosquito. And the reality is that there's a lot that even the most experienced health officials still don't know about Zika.
RT correspondent Marina Portnaya from Miami, thank you so much for staying on top of that story.
Thank you.